So I guess it's a real privilege to be a part of a conference like this. So there's such a focus on providing holistic care. And I think that one thing that's interested me in this space of eating disorders is the way in which the holistic nature of the condition is perhaps a little bit more obvious than in some other spaces. And there's some really good work going on in terms of trying to create more holistic approaches to care that consider both mind and body. But spirituality is still, largely not well understood in this space. So, as you know, eating disorders are a group of conditions that are characterised by disturbed eating behaviour and often by bodily distress. They are rising in prevalence. They have a profound impact on the people who experience them and also on their loved ones and those who are walking close to them. Having said that, disturbed eating is only really the tip of the iceberg in eating disorders, and underneath the surface, we've got complex and individual biopsychosocial factors which are often intertwined. And when people with eating disorders describe recovery, they often talk about more than symptom remission and identify things like relationships, hope, identity, meaning and purpose, empowerment and self-compassion as being central to recovery. And of course, you'll recognise the similarity there with many definitions of spirituality. Despite that, the roles of religion and spirituality in eating disorders aren't particularly well understood and certainly not well integrated into mainstream approaches to care. So there is evidence to suggest that religion and spirituality can have a mixed role in eating disorders, with some aspects potentially increasing risk and exacerbating suffering, while others can support prevention and recovery. There's been various approaches to spiritually integrated psychotherapy proposed, but they're not particularly widely implemented and they have limited evidence regarding usefulness, particularly in contexts outside of the US. So our project aims to help to address this. So the focus of our study is on Christian religion and spirituality. And we're aiming to explore the experiences and perspectives of affected groups in Australia and New Zealand regarding how Christian religious and spirituality might influence eating disorder development, experience, care and recovery. And then to co-create a resource which is designed to assist Christians experiencing eating disorders and those supporting them. So we had 4 participant groups, including people with lived experience, their close personal support, so family and friends, healthcare providers and Christian pastoral carers. And for everyone apart from the healthcare providers, they needed either to identify as Christian or previously identify as Christian or have had significant exposure to Christian contexts. Very briefly, we're using the double diamond approach to co-creation, but in this presentation, I'll just be focusing on this first discover phase, where we did 44 interviews with participants, and they averaged 74 minutes duration, and we analysed those using thematic analysis. It is worth noting that there was a bit of overlap. So in terms of participant groups, so for example, a lot of people with lived experience might also be a healthcare provider and other combinations there. We did have a majority of female participants, and anorexia nervosa was the most commonly reported eating disorder in our sample. We identified 3 major themes through thematic analysis, and I'll discuss those in turn. So first, for many participants, their eating disorder and their Christianity could be conceptualised as 2 non-linear and intertwined journeys. Participants explained that a sense of not being enough, whether that was good enough or safe enough, underpinned their eating disorder. That could be exacerbated by some experiences of Christianity. So, for example, we know that perfectionism is a strong risk factor for some types of eating disorders. And for participants, for some participants, that could extend into religious perfectionism and a sense of not being a good enough Christian. That could be intensified by some Christian faith communities suggesting that the person would recover from their eating disorder if they simply repented or had enough faith. And additionally, achieving a fit or thin appearance was sometimes equated with Christian care for the body, and that could then add moral weight to societal body image ideals. One participant explained that they had enough pressure in their own head around perfectionism and didn't need the added pressure of a church laying over the top. For some participants, experiences of religious and spiritual trauma also exacerbated their sense of feeling unsafe. And in that context, they described the eating disorder as offering a little haven through emotional numbing and control, for example. On the other hand, Christian faith could be quite deeply healing for people experiencing eating disorders. One participant explained that her Christian faith supported change in my heart and how I saw myself, rather than simply more symptom management or behavioural change, in her words. Several participants expressed that internalising God's grace or unconditional love and favour helped them to feel safe and reduce their striving to be good enough. One explained, as you see there, when I really get that grasp of grace, it doesn't matter what's gone before or ahead. You know that you're truly loved and you can truly trust that everything is in His or God's hands. The promise of God's presence and understanding also offered comfort and a sense of refuge, alleviating some participants' sense of not being safe enough. And additionally, an understanding of Christian identity and that food in their bodies were God's good creations could help to reframe some of those eating disorder cognitions. A second, all participant groups recognised that where it was relevant, incorporating religious and spirituality into eating disorder care could be important. So as one participant said there, I think it would have been helpful for me to feel like I was guided and supported in asking those bigger questions, because for me, my eating disorder was really hooked into all of that. That supported individualised care. It could enable spiritual struggles to be addressed and faith resources to be utilised for recovery. Awareness of a patient's worldview, interestingly in this context, could also prevent miscommunication. One technique that's commonly used in eating disorder care is externalising the eating disorder and encouraging the person to distinguish between their eating disorder voice and their healthy voice. And for some people, that could be interpreted in a way that suggested that the eating disorder was an evil spiritual entity, although it was quite unlikely that they were going to disclose that to their healthcare providers. Some people had experiences of spiritual integration in care, and those were often quite broad and non-directive, although sometimes more specifically integrated Christian beliefs and scriptures with Christian patients. Participants often appreciated their healthcare provider, considering their religious and spiritual beliefs. One distinguished between a provider who respected their beliefs, who they described as amazing, and another who really went the extra step to actively draw on them to support therapy, despite not necessarily identifying as Christian themselves. Third, and very briefly, carers and pastoral carers often felt underprepared to provide support to people experiencing eating disorders, and doing so was often harder than they had anticipated. For parents, the experience of supporting a child with an eating disorder often turned their life upside down, and Christian parents often drew on their faith to cope, finding comfort in God's sovereignty, although their faith community didn't always know how to helpfully respond. On the other hand, close relationships within a faith community could provide a really valuable source of support. So in summary, our findings suggest that Christian religious and spiritual influences are relevant to a subgroup of people who experience eating disorders and yet are often overlooked. Both healthcare providers and pastoral carers face barriers to exploring these with the people whom they support, and yet doing so appropriately when the patient wants this might make room for some of the deep existential distress that can underpin eating disorders to be addressed, as well as faith resources utilised for recovery. Within healthcare, basic religious and spiritual competency could enhance the work of eating disorder mental health care professionals. So that might include things like awareness of the types of religious and spiritual issues that people experiencing eating disorders might be facing, along with aspects that they may find deeply healing. Our participants suggested that spiritual integration might be compatible with a broad range of psychotherapeutic modalities, although further work is needed to develop and evaluate such approaches. Our study suggests important aspects when considering spiritually integrated psychotherapy for people with eating disorders. So those include, for example, the impact of malnutrition on people's ability to engage, well recognised in the psychotherapeutic space, but participants did point out that when you're dealing with these deep issues, it helps for the brain to be online. Potential relevance of under-recognised religious and spiritual trauma, and also the fact that religious worldviews might impact interpretation of techniques such as externalisation. It is important that if someone's providing spiritually integrated care for eating disorders, they are specifically competent in eating disorder care, because as anyone who has experience with eating disorder knows, what's helpful in this space is really not always intuitive. And of course, a multidisciplinary approach is essential. That may include a role for appropriately supported faith communities, which can really provide a unique source of embodied unconditional love and grace to those who are experiencing eating disorders, as well as supporting their loved ones. And so finally, to address some of the needs that have been identified in this work, we're currently working to co-design a website with our participants. It's intended to provide information and encouragement for Christians who are experiencing eating disorders, their close personal supports, and their pastoral carers and faith communities and healthcare providers who work with them. So different elements of the website for different groups. The design's ongoing and delivery is planned later this year, so watch this space. Of course, every study has limitations. This is no exception. I've outlined those further in our first paper, along with some additional information about our findings. So this paper reports lived experience perspectives. I've got another under review, which is looking more at healthcare implications. QR's there as well, and I would be delighted to hear any thoughts and questions.